A very good afternoon, everyone. So I'll be presenting our work on Sirolimus, a ray of hope for complex orbital venolymphatic malformation in pediatric patients. We have no financial disclosure. Well, venolymphatic malformation are benign hematomas, which typically present in the first decade of life, constituting around 1 to 4% of all the orbital lesions. There are various ways to classify them. Based on depth, it can be classified. There are various ways to classify them. Based on the depth, it can be classified as complex if it involves brain, head, or neck infiltration. And if there is no response to the previous treatment, then it also called as a complex orbital venolymphatic malformation. There are various management options. First, surgical debulking. However, higher recurrence rate, worsening of the cranial nerve deficits, and loss of vision has been documented. The second option is sclerotherapy. It's more effective for macrocystic variant rather than microcystic. However, still there is a higher risk of infection, compartment syndrome, and permanent vision loss. The third is the medical therapy. In medical therapy, well, sildenafil is more effective in macrocystic cases. Systemic steroids are generally not effective, and sirolimus is effective in both radiologic and functional improvement. However, till now, there are no guidelines for managing complicated orbital venolymphatic malformations. A word on sirolimus, it's a macrolide antibiotic which inhibits mTOR pathways. It reduces the cell growth, lymphangiogenesis. However, we have limited data on its role in orbital venolymphatic malformation, possibly due to the rarity of this condition. So based on this background, the purpose of our study is to evaluate the safety and efficacy of oral sirolimus in these cases. Our primary and secondary outcome measures are the following. We did a prospective cohort study, a detailed ophthalmological examination, radiological examination, pediatrician clearance, and baseline evaluation. The inclusion-exclusion criteria are the following. Our patients received sirolimus orally at the rate of 0.05 milligram per kg body weight twice daily. Our target serum sirolimus level was 5 to 15 nanogram, which was monitored at first month and then 3 monthly throughout the treatment period. All patients have received sulfamethoxazole and trimethoprim as a prophylactic measure for pneumocystis pneumonia. The response was divided into complete response, partial response, and absence of response. Coming to the results, out of 21 patients, boys dominated the study with a mean age of 12.7 years, and all cases were unilateral. All of our patients have received previous treatment elsewhere, either in the form of sclerotherapy or surgical debulking. The main presentation was proptosis followed by redness. The duration of symptoms ranged from 15 days to one year. The area of involvement in our cases was isolated orbit in 6 patients, orbit and PNS in 5 cases, orbit and scalp in 5 cases, orbit, PNS, and oral cavity in 3 cases, and orbit and brain in 2 cases. Results, well, the mean duration of treatment was 6.5 months, and at the end of the treatment period, our mean sirolimus concentration was 8, which was within the therapeutic range. Our mean follow-up was 15.2 months. Coming to the outcome parameters, the first, resolution of the lesion. Well, complete response was seen in 62% of the cases. Partial was seen in 33% of the cases. And one patient has recurrence and no response because of loss to follow-up. The second parameter, visual acuity improvement, it was clinically significant. The third parameter, reduction in proptosis. Well, the mean improvement was 2.5 millimeter in our case series, and it was clinically significant. The fourth parameter, safety. Well, our patients have had a mild reversible adverse effects, and one case had recurrence because loss of follow-up. Let's have a look on few examples. So this was a 10-year-old girl who had received sclerotherapy and presented to us with chemosis, diplopia, and proptosis and decrease in the vision. With 4 months treatment of sirolimus and 13 months of follow-up, her vision has improved and the proptosis has decreased. This was a second case of 8-year-old boy who had received sclerotherapy and the vision was 8 hand movement. The lip and the palate was also involved. At 12 months of follow-up with sirolimus and 14 months of follow-up, the vision has improved. There is no proptosis, but there is a mild inferior dystopia was present. Resolution of the palatal lesion was there. However, the lip residual hypertrophy was still present. And even on MRI, you can see that there was residual superior orbital lesion was still there. The third case shows she was a 16-year-old girl who had underwent debulking surgery and sclerotherapy elsewhere. You can see the scar mark here. She has undergone 9 months of treatment with sirolimus, and with 18 months of follow-up, her vision has improved and proptosis has decreased. If we compare the various modalities of treatment for orbital venolymphatic malformation, our sirolimus is having a comparable response and the recurrence rate is lower. If we compare to different studies where sirolimus has been used for complex orbital venolymphatic malformation, so with a larger sample size, lesser duration of treatment, the response is better and minimal side effects. These are our limitations. So to conclude, sirolimus is a promising and safe therapeutic option in complex venolymphatic malformation cases, especially where the conventional treatment has proven ineffective. It provides a ray of hope for patients facing challenging malformation. However, a larger clinical trial are needed to clarify the optimal length of treatment use as well as monotherapy. Thank you so much.
Any side effect did you find in these cases?
Yes, ma'am. So there were mostly systemic side effects were there, which were mild and reversible. Like there was mild leukopenia was there, gastric disturbance was there. Some patients also have mild neutropenia, but those all were reversible.
And what was the time period of the study?
So we have done 15.2 months follow-up, ranging
15
from.
months. So
Yes, sir.
your hospital is tertiary hospital?
Yes, sir. Tertiary Care Center, SGPJ, Lucknow.
Okay, fine. Thank you. That's why you are getting so many patients in
Yes.
50. Good, very good.